Great. So welcome. Today is a very special day to be able to share with you a topic that's very important to digital health on data privacy and ethics. This webinar is brought to you as part of the DCI network, a virtual action tank created by the Division of Clinical Informatics at Beth Israel Deaconess Medical Center, a Harvard medical teaching hospital. We've assembled an outstanding set of panelists from across the country who have deep experience in building digital healthcare systems and the important issues of how to protect privacy and promote ethics. These are people I greatly admire, not only professionally, but the way in which they go about caring themselves and the values that they share and promote. So today we will hear from Erica Chung, Adam Molnar, Tim Molnar, Nick Bott, Karen Fanger, and Mark Francis. And I appreciate you all spending time with us to be able to share your expertise. And what we want to do in this seminar is really try to dig in to understand what's possible in an optimistic sense, but also be cautious as to how these technologies could be misused and thereby create a lack of trust in the system and really send the field backwards instead of forward. I think there's a way of doing this with transparency and ethics. And it's really important that we understand what are those core values that we need to understand that guide us to decide how we build, deploy, and monitor these systems. So I'd like to pass it over to Erica to get us started. And I greatly admire Erica because she had the strength and did the right thing to speak up at her previous employer, one of her previous employers, to be able to speak about wrongs that were being done there. And eventually the government and other agencies did their part. But it takes courage to stand up and hear your voice, make your voice be heard so the right things happen. She now leads a nonprofit that promotes values and ethic and entrepreneurship, which I think is really core to us to be able to make sure that all the next generation of people creating new companies have core values that guide them. So let me pass it over to Erica to get us started. Thank you, Erica.
Thank you, Yuri, for the wonderful introduction. And thanks everyone for joining us here today. I'm going to be sharing this conversation with Nick Bott, who is currently the global head of bioethics and technology ethics at Takeda Pharmaceuticals. And I think to Yuri's point, what he kind of talked about, what we wanted to sort of start the conversation with is sort of talk about the possibilities of some of the things that we're seeing in the healthcare industry, and really looking at how all of these new digital technologies are really creating new frontiers in the way in which we create new therapeutics, in the way in which we create new diagnostics, and really provide better quality care for patients across the board. So Nick, I kind of wanted to get a sense from you, what are the things that at Takeda you guys are excited about and see the potential for some of these new types of digital tools that are helping inform the work that you do?
Yeah, sure thing. And just real quick, thanks for the invitation to be here. It's great to be on this panel with such esteemed colleagues. And I think to your point, Erica, I mean, this is an exciting time in healthcare. I think we're seeing and witnessing in real time what happens with technology, and that it is always accelerating. And we're seeing a little bit of a nexus moment between some foundational types of technology like AI and ML. But we're seeing that now be infused in ways that make a lot of what we can see in the digital health space become less and less of a kind of a first trial or a pilot and a fast maturing. And so whether we're talking about smartphones or rings or sensors or patches or semi-permanent tattoos or sensors in your clothing, we're in a very different world than we were a decade ago, not just in terms of the types of devices and signals that we can acquire, but the ability to acquire them at scale and in ways that are much more mature and robust. And I think when we think about the applications in healthcare, that's incredibly exciting. I have often said that, as we see these advances in technology, the question I always ask is, what data is not clinically relevant?
Mm.
And I think if you really stop and begin to ponder that, you can realize that most data has some clinical relevance. And that's really exciting, because I think everyone who spends time in healthcare is excited about the use of data to make better insights possible for patients, to advance how we can bring solutions to market, whether that's in medicine or whether that's in the ways that we can support patients. And we're kind of witnessing, as I said, in real time, how the foundational technologies are really making that a reality for us to see. So that's a really exciting opportunity that I think is before us. And I think we're also seeing a converging now of what was originally seen as, I think, a big silo between digital health and more traditional healthcare players. And I count kind of pharmaceutical companies in that space, to now one where there is a lot more excitement around the combination of how those things can work together.
Yeah. I think one of the interest I had, so sort of playing off what we saw at Theranos and why the hype around that was so big, was because point of care diagnostics was the merging of kind of these two worlds, where if you had more accessible, more affordable diagnostics that patients would feel more comfortable getting on a regular basis, what you could do is, instead of getting one snapshot into their health or two snapshots, you could almost build this dynamic storyline and have more continuous monitoring. And with that data, maybe glean insights about, what someone's health status was, or predict disease potentially before it sort of happened. So on that note, that, that was a really exciting prospect, to be able to sort of harness all that data and utilize the sort of hardware technology to be able to access that type of information. But I think on the flip side, there's all of these wonderful things that you can do with this information. But if it's not handled with care and high levels of ethical standards, not only in the data management practices that you have, but also at the organizational level, it could lead to these huge chasms in trust.
Mm-hmm.
And you have a situation, I think, that I saw in the Theranos case, where we saw this halo effect for point of care diagnostics, where now anything in that space tends to be, how is this not the next Theranos? And that's sort of a scary prospect for someone who cares about that space, but then also for the industry at large. So I wonder from your perspective too, because I know even Takeda has a chief trust officer, clearly
Yes.
you're in a position sort of to establish these standards. And I think many people sort of intuitively know that we need ethical standards in order to ensure the safe research and deployment and commercialization of these technologies. But what does that look like for you, and what are your kind of takes on that?
Oh, it's a great question. First of all, I think predictive, proactive, point of care, personalized, right? All of these P words are certainly words that no one is against in terms of what we're going for in advances in healthcare and the use of technology to get us there. But to your point, any company that innovates has what Shannon Valor talks about as a social license to operate. And that social license to operate is a relationship of trust between the company, right, or the organization, and the broader society or public or publics, within which they're embedded, in which they're providing this innovative product or service. And I think for obvious reasons, healthcare is an area where the importance of trust is paramount. And to your point, when we see these halo effects, they are, I think, a stark reminder for us of what happens when that social license to operate is confounded or abrogated because of poor behavior or any number of reasons, whether it's intended or unintended. And I think, as I mentioned earlier, there's a really interesting reality happening right now in the field of healthcare, because we see a combination of types of players in the healthcare system that are much more accustomed to the needs of maintaining that kind of social license to operate, and kind of new and emerging players that have really interesting opportunities to disrupt and innovate in this industry, who may not be as accustomed to some of those regulations and some of those ways that there are expectations, right, for how we do this the right way. And I don't think anyone does, everyone can continue to get better at this. But I do think, when I look at digital health today, we see players on the pharma side, we see players in kind of the startup side. And everyone, I think, needs to be able to share a language about what it means to build and maintain societal trust when we're working in this space. Because, as you mentioned, it's not just within a particular area, like you mentioned, point of care diagnostics. I think it actually kind of has a ripple effect even outside of that particular application within healthcare, where we begin to see an erosion of trust or worse, kind of a sense of kind of cynicism about, hey, is there really any positive, intent with what people are trying to do in this space? And I think that is, to me, a foundational motivation for work that I do. You mentioned kind of our digital trust officer at Takeda is kind of this recognition that we have to build and maintain trust with our constituencies, not because of some ulterior motive, but because that is actually how we develop this ecosystem for everybody in a way that everyone can benefit. It cannot be purely kind of a selfish motivation.
Yeah. When you think of this value of trust and how you're incorporating into business practices, how do you feel are the effective ways that you can kind of maintain that over time? Because there's always going to be trade-offs, right?
Yeah.
There's going to be the trade-off of wanting to keep that trust, wanting to maintain high integrity and ethics in the context of business, but then also there's always this sort of tension sometimes with other business operations that might be occurring.
Yeah. There's always a tension. I think it's on the one hand, I think you have to recognize the place that your particular organization is in. So, for example, Takeda is a 240-year-old company that's had a set of values for a very long period of time. So there's a really strong foundation you can build on there. I think for other companies, right, or startups, that might be something that requires more intentional building and shaping at the start to really develop a language and a vocabulary that can be disseminated and understood and propagated by the employees. But regardless, I think creating and having a conversation where there's shared language, and this is kind of where we typically talk about things like principles and kind of values is a foundation stone. But I will be very quick to say that is a necessary but not sufficient part of how we do this well. So when we're thinking about organizationally, how do we move from just standardizing a language and making it comfortable for people to have these conversations, which I think is a lot harder than people sometimes want to give credit for. We then need to kind of take the next step, which is we need to be able to have very practical conversations about what ethics means in the applications that a business is working on. So we actually have to be okay naming what's a good outcome and what's a bad outcome. And then begin to, whether you have the technical sophistication to work with the particular technology in question or the device or the signal in question is not as important as being able to have the conversations cross-functionally, because everyone is a part of kind of building or shaping that technology for that end user, and to be able to come back again and again to that set of questions of what is a good outcome and what are the bad outcomes that we're trying to avoid, because that's actually how we reiterate kind of what we're trying to affect and how we eliminate or mitigate the risks or the unintended consequences that we're trying to avoid. But I think a lot of times we can get siloed either at the level of it being too general and high level and not diving into the details, or we can be siloed in the area that we're working in and not have that cross-functional discussion to really understand it comprehensively.
Yeah, so I think we have about 1 more minute left. And so one of the final questions is kind of continuity of this. So there's this siloing that kind of occurs. And when it comes to ethics conversations, it's like, oh, that's reserved for the ethicist, or that's reserved for the ethics department. And when it comes to sort of training and engaging people on these sort of standards and these principles and embedding that, how do you think about approaching that from across departmental guys? And a lot of it sounds like what you said, these conversations of really encouraging people to partake.
It is, I think one of the places that we have a lot of work to do as an industry is to recognize that ethics, while there are certainly areas of expertise that have roles like mine, but my role is not to be the one-stop shop for being ethical, right? I often say, ethics is a team sport, and everybody in our company has a responsibility to be asking these questions about what are the good and bad outcomes that we're either aiming for or wanting to avoid. And you're right, there's a lot of communication and dialogue that is necessary where you can get to have conversations with the product teams, with the teams that are doing the innovative work, which I love. Having come from that background, that is something that I relish, but it is also something that requires conversations to help people get comfortable with, because there is some activation barriers a lot of times around, well, I don't know how to think this way, or this doesn't feel natural to me, I'm going to leave it to someone else. And I think we need to get over that, right? Help people understand everyone has a seat at this table, and we cannot answer this question in silos.
All right. Thank you, Nick. And I think it's time to turn it back over to Yuri for our next conversation. Thank you, everyone.
Great. Thank you, Erica and Nick. Some people had problems connecting, and we apologize. I think the links may have changed, but we did email everyone with the correct link. And so if you came in a few minutes late, we are recording it, and it will be available online, so you'll be able to go back and catch the portions that you missed. We apologize for that. Okay, so I think there were a lot of golden nuggets in that discussion, and I believe issues of trust, shared dialogue, and what's clinically relevant. And I think in this day and age with AI, where we want to grab as much data as we can and then try to figure out what to make sense of it, I think it's going to be an interesting discussion of how we go about deciding how much data we collect to be able to analyze later, which might end up being useful, and how much might be an overreach and may be abused. And so I think we'll be able to dig into these points later on in the open discussion. And so I encourage you, as we go along, please add your comments in the chat area, and then there'll be time for you to verbally ask them as well. So thank you both. And I apologize, when I think of Adam and Tim, I think of Murray so closely, I mispronounced Tim's Lauer's name. So apologize, Tim, for mispronouncing your name. So next up is Adam and Karen, and we want to sort of explore another important issue of this is really, what about wearable data, which also give a plethora of data. And there are tremendous opportunities there, but there's also potential risk of what happens to that data after we collect it. So to kick us off, Adam, if you could please lead off the next section.
Absolutely, my pleasure. And just an extra thank you to Erica and Nick and the whole DCI community. It's been really amazing so far. I'm really excited for this conversation. Karen is someone whom I've known for several years now, and actually have a working relationship. We are in a unique situation where my company, Neurable, we build neural interfaces that integrate with consumer electronics. Karen, or Dr. Omelfinger, is a former professor at Emory and current head and founder of the Institute of Neuroethics. She and I speak on a fairly consistent basis, talking about the implications of our technology and what this means in the grand scheme of things. So to open us up and discuss where we're going, Karen, I just want to ask you, from your perspective, where do wearables sit in this whole seat of the ethical data consideration?
Yeah, thanks for that. I'll just share, it's a great first question. And I just wanted to share that in addition that I'm a neurotech ethicist and strategist. So I'm a retired neuroscientist, professor, and director of neuroethics. And really, I focus on neurotechnologies. And for those of you who may not know, those are devices that communicate with the brain and spinal cord, either through surgery or external sensing wearables that we're talking about today. And neuroethics is a field that explores the unique ethical, legal, and social implications of technologies that interface with something that's culturally embedded and important as the brain. So I think a lot about identity, agency, and autonomy. And these are the types of things that Adam and I have talked about on the global circuit, thinking about how technologies are transforming our lives. And our mission of the Institute of Neuroethics, Think and Do Tank, is to help neurotechnology stakeholders to know how to better leverage their role in creating a stronger neuroethics ecosystem. So I'm thrilled to be here. I think to your point, Adam, another point I want to emphasize around technology itself is that the burden of disease, particularly in our world around mental health, brain diseases, and the need to empower agency to flourish, to be well, make development of these kinds of technologies an ethical imperative. So I know we're talking a lot about the importance of trust, but the creation of these technologies is also ethically important. So wearable technologies, I mean, or carrying technologies. In Japanese, your phone is keitai, which you hold in your hand, you carry with you. These are embedded with a lot of sensors, and these offer us kind of the holy grail of being able to understand behavior in the wild and maybe develop even treatments, clinical treatments, or ways that people can help themselves and offer them a way to find self-efficacy and improving their lives. And I think that comes with a lot of positive opportunity. We can pre-diagnose, even predict what kinds of diseases people might have risk for based on keystrokes on their keyboard. We can look, there's accelerometers in your phone. There's voice analysis, which has been done also to understand development or predict or diagnosis even of COVID, which is being explored. Text analysis, and this includes in your social media. And there's also GPS, of course, and the list goes on. So there's a lot of promise for development, both in the hands of in the lab academic researchers, or in the lab, primarily research-oriented entities like at Takeda. But there's also opportunities to mine a lot of data for people who aren't formal researchers in those labs. And I think it's changing the norms of our relationship of how we see ourselves and how we even quantify ourselves and what we see as a future world that we want to live in. And I think, Adam, this is something you probably think a lot about too in your world, and why you're even developing what you are. Maybe you would like to weigh in on that.
Yeah, so just for everyone's background, my company is called Neurable. We are shipping consumer electronics enabled products with neurosensing to give biomarkers on overall health, performance, very much how people use fitness trackers on the wrist. We're building that for the head. So this has been about a 10-year journey. And when my crazy neuroscientist co-founder asked me if I wanted to join him, one of the first things I thought of was, we need to set our ethical guardrails in place, because this technology could get really way ahead of us. And connected to that, I want to pass the question back to you, Karen, which is like, at what point is the information too much?
I see in the chat some references to Europe and GDPR, and there's a lot of good guidance recommended by the GDPR, along with some tools. And one of the tools invites those collecting data to think about something called data minimization. That's, do you really need this data? Do you have to collect all of it? But the tension, of course, is what Nick mentioned, that is all data potentially could be healthcare data. So what's the right way to go here? I think the other point is that we have to think carefully, especially about brain-related data, or data that might seem kind of sensitive, that the type of data we're getting from wearables like yours, could be seen by some as proxies of mental states or interior states that used to be considered totally private and free, only yours. Maybe that's changing a little bit, but there's others who might argue that, well, this isn't really different than other data. This is just kind of numbers and crunching like that. So I think we're in a really interesting space with data collection. I think I veered actually from something you were saying.
No worries.
I got distracted by the chat, sorry.
Yeah, the lot of good questions popping up. But what I was getting at, I was asking about, when is the data too much? I was having a similar conversation, giving a presentation at MIT, and someone from the audience asked the question, what if I don't want to know that I'm predisposed to an illness or a disease? How do you recommend that the relevant stakeholders toe that line?
I think one of the solutions that's kind of should be obvious, I think, but maybe isn't, is to engage the end user. So there was a big analysis of existing regulation around something called technologies called brain-computer interfaces and looking at standards in that space. And one of the big deficits in that space was setting those standards, setting those technical standards with end users in mind and the capabilities and metrics that they wanted to see in those technologies. I mean, I think that companies, developers, user experience teams can integrate more robustly some of these ethics questions around what kind of data do you want collected, what kinds of interpretations would you want to see of these data, and also, certainly those processing the data have a responsibility to express the reality of what they can actually infer from that. I think we see a lot of companies, and I think we see wishful thinking academic scientists too, suggesting they can find things that they really can't. And that's something important, because otherwise, I think one anecdote I can share that's not related to neurotechnology, but is with genetic, home kit, do-it-yourself sort of home kit genetic testing, is that I knew of someone who bought his wife one of those kits for her birthday, and she tested and was shown to possibly have a higher risk for Alzheimer's. And she said to him, I don't know how to interpret this. Do I need to now buy a gun? I mean, it's very, really dramatic example, but people wonder, they assume because this is quantitative that somehow it's going to reveal a different kind of truth to them. But there's a lot of wiggle room in understanding what the nature of that data is, what it really means. And also we need to be working with the end users, the patients, to better work with them on how to express and communicate about the types of data they're collecting and the types of data they might be able to receive.
Yeah, the future is an exciting place. I want to take a step back and ask a little bit more of an abstract question, which is, in thinking about the issues that you're working on a near daily basis, we see these threads, this fabric of data enveloping us, whether they're carryables or wearables or the pieces of technology that we're using on a daily basis, cookies. What do you think that means to be human, and where do you see data playing a role in that?
That's a perennial question. What does it mean to be human? I think as technology has always, as I see it, and I think many others too, been a social mirror. What we create reveals kind of our desires and interests. So I don't think necessarily, I wouldn't say we're becoming less humanized. I think some people might say that, fearful of technology, we're becoming less humanized. We have fewer values that we're in touch with. I think we're forming new relationships with technologies that, and we are also currently exploring what is the nature of those relationships. So is this a tool for better understanding myself? Is this a tool for augmenting myself, enhancing, improving myself? Is this tool actually a collaborator or its own identity on its own? So I think that I wouldn't say that we're becoming less human, but I think the ways we're interacting in the world are being changed. And yes. I'm not sure we're prepared for that future. I don't think we talk enough about it.
I couldn't agree more. And I think we have 1 minute left. So just to close that, how do we get ready for that?
I think I know we're in a time period, and I've talked about this with a lot of policy entities that claim that public engagement is important. And I also hear a lot of people say, after COVID and in conversations with anti-vaxxers, why would we want to talk to the public? Clearly, they won't listen. But I think it's the time to double down, actually, to better engage with the community and the variety of publics. And publics could be, a variety. They could be policymakers, they could be patients, they could be patient advocates, lived experience advocates. I think this needs to be held up at the front. Even academics, there's great scholarly work coming out, not in touch with the humans that are using the technology. So I think we need more of that.
Amazing. Dr. Onfinger, always a pleasure speaking with you. And again, thank you, Dr. Quintana, for the opportunity and the rest of the presentation.
Great. And thank you both. I think you raised a lot of great key points in ethics and values, and what does it mean to be human is kind of really relevant now in this day and age with all these ChatGPT and other generative AI, and at what point do systems become simulated almost with consciousness. And the one thing we humans, well, some humans can do is sort of show good judgment of ethics and values in terms of what we ask or how we tell people. And I think when we collect tons of information or are making inferences, whether we're either suicidal or at end of life or possibly at risk of grave disease, what's the right way to present that in an ethically appropriate, empathetic way becomes really, really important. And we probably aren't talking enough. I think the technology is speeding ahead of us farther than we have. And so before we fill up the room with all kinds of lawyers to talk about this regulation, we can't forget the humanists that are involved. So thank you for raising those important issues. And then next we go to Tim and Mark, who are going to talk about the home space, where it's a vastly, rapidly growing area for home-based monitoring, remote monitoring. One of the startling things that I've seen, I've started to work on Alzheimer's and dementia, is that the number of people that are going to be affected with Alzheimer's or dementia, either themselves having it or caring for a family member, is dramatically increasing. We're living longer because of modern medicine, but as we live longer, more people are having to live with dementia or a family with dementia. So technologies that come into the home can potentially greatly help us monitor and provide warnings, but it might also be an overreach if we don't do it transparently and ethically. So to explore this area of what's possible and how we should be behaving ethically and appropriately, I'm going to pass it over to Tim to get us started. Tim?
Hello, hi, Tim Lauer. I'm located in the San Francisco Bay Area. And over the past several years, I've been working with a number of different startups in healthcare, AI. And my guest today with me is Mark Francis. And Mark is currently Chief Product Officer at Electronic Caregiver, where he'll tell you about his company that has some pretty innovative devices that are in the homes of seniors and others who are in transitional care or to support elderly care. He also has done a number of interesting things, including been at Amazon, where he had a leadership position in robotics, which takes into account a lot of AI. Also, Intel and digital healthcare. He's been at a CRO in Europe and also some smaller companies. So a very interesting background. So Mark, I think I'll tee it up for you, since there are a lot of devices that your company has put into the hands of consumers as well as healthcare people. And so when they ask about, are the devices listening to them, and are they hearing things that they don't want them to hear? How do you explain that to them as a consumer or as a healthcare professional?
Yeah, thanks, Tim. Great question. And thanks for that introduction. Really happy to be here and part of this conversation. Before jumping into that, just to reflect on what everybody's talked about, it kind of reminds me of an old book by Alvin Toffler called Future Shock. And it's all about how, the pace of what's happening in society is accelerating so much. And that's particularly the case in terms of some of these emerging technologies and how they're impacting the benefits that they're providing, and also the questions that they're raising as well. So whether that's robotics, AR, VR, open AI, voice, wearables, we're in a very, very interesting time. I think when it comes to voice, a voice is really interesting. So the base question, are our devices always listening to us? Yes, they have to, because that's how they were designed to function on the whole. That said, it's interesting because then how is that listening capability being used? Is it only being used for the said function of a device, an Alexa, a Siri, something like that? Or is it being used more broadly than that? I think if I look at voice, one thing is for seniors, older adults, folks with different, chronic conditions, or perhaps, vision or dexterity issues. Voice has been a godsend. It has created a way to interact with products that for folks that were either not digital natives or who had some limitations and was very hard to navigate little buttons on a little screen, voice has opened up connectivity and the benefits of the internet in ways unimaginable. So I think you've seen a high level of adoption in this sector for that voice-enabled devices because of the benefits that they provide. And also voice provides more than merely in a way to navigate and engage with a device. Voice from a healthcare perspective can be used, you can pick up, is there someone anger? Is there signs of stroke? Is there signs of changes that might be an indication of, early onset dementia or Alzheimer's? Voice can be used for emergency response. Voice can be used to hear if somebody has fallen. So there's a lot of use cases associated with use of voice in a home that can be highly beneficial above and beyond what that entry might be through an Alexa or an Addison or a different type of device. It's very, very, very interesting.
Okay. And if you think about, electronic caregiver and the services you provide, how do you describe to, your customers about, the security or the privacy and the line that you draw between trying to provide them service and the amount of information that you're gathering?
Yeah, it's interesting. We're bringing to, it goes back to my Amazon and Intel Digital Health days. We're bringing together two very, very different universes, healthcare system and technology companies that traditionally look at privacy 180 degrees differently. And it's an issue. It's a big challenge. And part of it is, but on top of just the fundamental industry differences, we as a society, whether it's our companies or our funders as a private company, we've got to a place where we accept that we do not prioritize privacy. And we have created a situation where people are willing to sign away their rights of privacy to be able to use products. So we get these EULAs that no one looks at, that basically sign your life away. Well, that's functionally, I understand why that happens. It's not really have the patient's best interest in mind. So I think fundamentally we exist in a universe that is problematic in the US, how we've addressed these issues. And we can talk about maybe some ways to address that down the road. But for us at ECG, when we looked at this, we looked at how do we view data, how do we view data privacy, and we decided to do something fundamentally different. So while we built out our system mostly on an AWS cloud basis, we haven't done that for our use of voice. So instead of using Lex, which is the chatbot with AWS to do our voice interaction through the cloud, we actually decided and instructed our system and our services to do all voice locally. So we're using a different service from a company called Sensory, and we do all the voice interaction local on the device. It costs more money. It took longer. It meant we needed to have, if we get into the geek world, and Intel Core i5 product instead of a AMD product because we needed the horsepower and the memory to be able to do things locally instead of through the cloud. The only time we ever go out to the cloud, if somebody says Addison help, those two words coupled together will call for emergency response or create an alert mechanism depending on what's right for that patient. We did that because of the population base that we're dealing with. We thought it was critically important that individuals, in terms of their interaction with the device, have a higher level of confidence in terms of privacy and security for their interaction with the product as well. The other thing we've done too is we're using either a PIN or a visual identification to display personal health information. So you cannot have an interaction or a conversation with Addison unless it's confirmed that it's Mark or Tim or Kaylin that's in front of the product and interacting with the product. Because one of the issues with like an Alexa, for example, of if you're using that from a healthcare setting, you have no idea who's in front of the Alexa, who else might be in the home, and information that might be private, confidential, not for public consumption could be inadvertently shared. So we've tried to construct a system to be mindful of that and try to get ahead of some of those things.
Okay. Yeah, you and I have both worked with companies who used computer vision. So that required a camera in the home.
Yeah.
And there are a number of techniques for obfuscating data and, providing privacy. Thought it might be interesting just for, we have this esteemed audience, if you could reply yes or no in the chat. And here's the scenario. You have a parent or a loved one who is, we'll just say in our case, over 80 years old, living at home alone. And there is a service available that, provides this artificial intelligence that through the camera can detect whether or not this person maybe has fallen down, maybe they're skipping meals, they're sleeping irregularly. Yes or no, would you allow that, or would you not allow, would you put that in your mother's or your father's or whomever, or loved one's home to assure, that you wouldn't have a scenario where maybe they fall down and can't get up or something like that? Would that be an acceptable solution? Yes or no for a video? Okay, gonna have a lot of answers on that. Mark, why don't you tell us about how you assure, folks that are elderly that still, are fine, but are at risk, a high risk of falling, and how do you assure them that, the security settings of their devices are secure, in fact, and are private, whatever issues they may have?
Yeah, it's really interesting. I think that all this stuff, I think, needs to be really turned on its head. I think left to their own devices, pun not intended, the providers at play here will not make it easy to turn off some of the capabilities that they want to lead with. But I think we need to have a system that is opt-in instead of opt-out. I think individuals need to provide consent for their own use of voice or camera-based technology, and that use should be extremely limited to what that use case is. It should not be then widely available for companies to use for advertising or other means, again, unless it's a very clear opt-in. They should also have, the patient also should provide consent for who else gets access to that data, whether it's a loved one, whether it's a provider, whether it's somebody who works for the company or a contractor for these companies. Again, too much of this stuff becomes once you interact with it and it goes out into the cloud, who knows where it goes. The other problem is if you have a multi-purpose device that you are interacting with, you have very likely downloaded a whole bunch of other apps, and you have given permissions for stuff that you would never give permission with if you knew what you were doing, which then could just further open up the spread of that data and that information. Myself personally, I have turned Siri off of every device that I have. And if I have an Alexa, I have one plugged in. If I have other Alexas, they're unplugged unless I'm in the room and I want to interact with it. But the burden shouldn't be on the user to have to do that. We need to get to the point where the default is it's off unless the consumer or the patient opts in.
So pass it back over to you, Yuri.
Great. Thank you so much, Mark. And, and Tim, and I think one of the things I'm really impressed about all our panelists is that, they've been thinking about this not only as a good thought, but they've sort of exhibited it in their practice. So I think, Mark, you putting that extra work, and even though it was extra cost to put it into the design, and you, Adam, as well with Neurable, that was sort of predated your company, but that continued into your company, the ethical values that permeate how you design that, I think are really important. So I think we're going to go and ask the panelists now to comment. We're going to give 5 minutes to each pair to comment on the previous comments. And one thing I guess is interesting to me is sort of like, where do the values and standards come from that how we go about designing things with ethics and security and privacy? Should they come from individual companies? Should each one develop our own? Should we have a national body that helps create a set of ethical guidelines? And then who should oversee that in terms of compliance, right? Should we leave it up to companies to self-report that they're following that? Should we have government regulations? And, this is sort of, I know we like to have a free market society, but are there things that you shouldn't be free to do, that we should have to have transparency and accountability? And so that's probably a great topic to lead back to Erica and Nick, because Erica has a foundation focused on transparency and values, and Nick's organization has put a lot of work into transparency and values, and we posted some of that in the chat as well. So 5 minutes to you and Erica and Nick to comment on what you've heard so far.
Yeah, I think it kind of roots back to Charlotte's question. Can we really expect for-profit companies to put trust and ethics above monetization in certain ways? And then if no, what kind of comes next, and what's going to happen? Mm-hmm. And I think it's probably going to be multi-layered, right? There's not going to be a very definite solution in terms of how this is supposed to be handled. And then actually the reality of how it is being handled already seems to be fairly fragmented. And Nick, I'll leave it to you. You know more on the legislation side of how that's happening. And I imagine being a part of an international company, this is a big topic of interest.
Absolutely. I think it goes without saying that, within the pharmaceutical industry for a long time, we have had regulatory bodies like the FDA or the EMA providing a very clear and directed and regulated path to bring a medicine to market for exactly the reason of the conflict of interest between a potential good for society, but a for-profit company. And I think that is very familiar territory for the pharma industry. I think it's not necessarily as familiar territory for those who haven't, who are in the kind of health sector or the digital health sector, who haven't kind of grown up in that regulatory environment. But I do think there is a reality to that conflict of interest. And that's why we have bodies like the FDA or the EMA playing the roles that they have. I think increasingly what we're recognizing, and I think a lot of the other panelists were kind of commenting on that with the types of technology that we have available to us now and the types of data that they can provide and the opportunities they can provide, they also bring a host of similar questions. What are the potential conflicts of interest of the use of this data? How are the ways that can be either used for nefarious purposes intentionally or just unintentionally kind of bring harm to end users? And I think hence I think why we are seeing a chorus for more regulation in the space. That said, I would stand by I think my comment, and I think Karen, you had kind of seconded it, that oftentimes regulations play a minimum standard role, and it kind of goes back to your point, Yuri, that I think ultimately this is where the role of having very important, clear conversations about ethics and values for companies become paramount, because that is actually a much stronger opportunity space for shaping behavior and shaping how a company is built. You know, I'm even kind of referencing a little bit of Mark's kind of anecdotes about his experience. You know, those are more salient for individuals, whether they're building a company or employees that are part of a company, oftentimes, than an external regulation. And I don't think it's an either or. It's likely going to be a both and. But I think we're only going to see a greater degree or of need to kind of have these conversations when we have technologies like you know, GPT-based systems that are now essentially open source, right? We're kind of living in this space between what's going to happen with these types of technologies as they get further democratized. And but yeah, I think we're going to see more regulation, and I think we're going to see a diversity of that regulation depending on the postures of the countries and regions that are enacting it. But I also think we're going to see an increase in individual companies' roles and how they think about developing their own standards, either individually or with other companies in the space.
Nick, we kind of talked about this offline a little bit. And Mark, you touched upon this, that there are two very different industry perspectives on privacy, coming from the technology industry and coming from the healthcare industry. And it almost seems for digital health or anything related to healthcare, there needs to be a really strong coming together of these two different perspectives into formulating, okay, how are we going to handle developing standards that can kind of accommodate these two worlds based on the infrastructure needs of how you develop these technologies and do the product development, in terms of the deployment, in terms of the considerations of the regulatory landscape and how you manage two of those worlds, in terms of the lack of regulation that's happening, but being proactive about what are the potential risks. And Nick, I think you call it like the what if scenarios of what can happen in the future. And so I think this is also going to be a really strong push is we need more cross-industry conversation and collaboration on how do we really marry these two different worlds, these two different ways of doing things in order to ensure that there's better cooperation and that you don't kind of just have everyone sort of fighting over the not being able to sort of speak the same language versus sort of really coming together and figuring out, like, these are tough questions. You know, it's not going to be easy given all the different needs that each party has. How do we kind of come together and formulate that?
Yeah, and I would quickly add, Erica, that we've seen a couple of these living experiments play out, right, during the COVID pandemic. We recognized simultaneously the incredible value of public health data to support large-scale public health, and yet it comes at a certain cost when you think about the privacy of health data. And we also saw this play out differently in different areas of the world in terms of how different societies valued aspects of that data. And it's by no means a settled question in most of those, most of these areas. And I think we're only going to see, more and more of these kind of living experiments as the data becomes more freely accessible through all of the mediums that it's going to be collected. And so I completely second the need to have these conversations up front and to take the time to think through the potential scenarios, right? The what if scenarios, because it's not an exercise in imagination for, just to kind of kill time. It really is an opportunity for us to think, well, what do we value in that situation? If this is the outcome, what do we value more? Do we value the preservation of a person's, data remaining private, or do we value a greater good for society? And that's an inherently ethical question. And that has to be a question that we, larger than a single company, is trying to answer on its own, because it's going to have implications for a lot more stakeholders than just one company.
Great. Thank you so much, Erica and Nick. And I want to pass it over to Karen and Adam to comment on this. And, I guess if the question of jurisdiction will be interesting, right? Whose jurisdiction is it at the state, national level? There's European Union agreements. Then there are industry standards that could come into play. And ultimately, maybe individual companies may have their own internal values. And the question of what should be in those ethical values, regardless of where they come, what should be in there. And so I'd like to pass it over to Karen and Adam to comment on anything you've heard before. What has resonated the most for you? What do you think should be high priority?
Yeah, I want to highlight some common threads throughout the three sets, which are that I think we all agree that this is a multi-layered issue. One thing I would want to advocate against is this concept of ethical hot potato, where it's like, no, the small companies should do it because they're more limber, or no, the big companies should do it because they have more resources, or the government should do it because that's their job. Like all of these considerations, but I think what all six of us have united around is that it's not one or the other. It's all interconnected. And in addition to that is this other major beat that is that a lot of this is anchored around trust. So I wanted to inject a little bit of a dynamic, and often one that unfortunately I think gets left out in ethical conversations, which is we talk a lot about bad actors, but we don't really necessarily talk about the upside. So I wanted to just pose back to Karen and honestly all of the panelists, whomever wants to speak to it, like what is the upside of an ethical strategy?
Sure. Okay. I will respond to that, and there's lots of other things, but I know we have limited time. I think as far as, so I've turned into looking at ethics strategy because a lot of the state, national, international, all these standards that we have are really difficult to implement. And a lot of times, it needs to be multi-layered, but there isn't enough conversation to understand the language, as Erica pointed out, but also the reality of working in that space and kind of the tensions that you have. What are tools that would actually be useful in a cross-functional team, as Nick mentioned? And I love this ethical hot potato thing. But there is certainly in integrating it into the business ethics, into the business strategy of the company can pay dividends forward. I mean, certainly what we are seeing was that to attract talent these days, companies do have to have ethical orientation, a set of values that they articulate, and those can come from a variety of places. To be creative, we know there are studies that show ethical imagination can improve creativity and problem solving, and this is something that especially helps if you're in the industry of creating, coming up with creative solutions. And it's a plan for sustainability. If you want to work to last, like Takeda, who has over 2 centuries or something of history, then you've got to do that. You've got to be able to. Trust is a tricky word, so I'm not sure how I feel about using that. It's loaded and it has multiple meanings for people, but that's probably the philosophy background in me. But I think if you want people to continue to interact and communicate with you and feel like you know what their needs are and that you're responding to them, you're going to have what I say are kind of three pillars of the way I conceptualize trust, which are competency, consistency, and benevolence. And I think the benevolence piece is missing from a lot of people, because for benevolence to be felt, you have to understand what is the lived reality of those individuals, whether they're in the company or the end users. But one other piece that I wanted to add, well, there's one is just quickly, privacy isn't one-dimensional. People talk about it like it's one thing. It isn't. There's decisional, informational, proprietary. So we could talk about that later. And also the thing that I also want to share, that technology can be wonderful, but we also need to be wary of technological solutionism. So installing a bunch of technology in a senior living facility isn't going to solve the problem of not having enough nurses who are paid a living wage to take care of those individuals. So I think those are other elements that we need to think about that may even be, or as important, if not more important, privacy element.
Great, thank you so much. Let me pass it over to Tim and Mark to spend 5 minutes commenting on what they've seen. And I really think they bring a great perspective, because as much as big as healthcare is at the hospital setting, most of what happens in our healthcare life is at home. And there's a plethora of new companies, both large and small, coming into the space. And I don't think we've really understood that landscape. And it's interesting to me that two of the largest companies in the world, Philips, which is a lighting company, somewhat is now a healthcare company. Best Buy, a retail computer company, is now becoming a healthcare company. And there's a whole range of startups. So would love to hear as this whole new sector, which might end up being as big, if not bigger than the existing traditional healthcare system with family caregivers at home. What resonated the most with you, Tim and Mark? What do you think is most important to focus on?
Sure. I think with the studies show that if you work with a baby all the way up through their teens on ethics and values, it's more likely to become part of their DNA, right? And the work that we're doing with startups, there's been a lot of initiatives over the years, and ethics it's been on the scorecard, but it needs to be updated. As technology's updated, there are new angles to look at ethics, just like there's a big push now, which rightly so, for diversity. There's been, there's always the financial, there's always the question, the business. You go into a VC, it's like, tell me about your business model, but it needs to be up on the top level of the scorecard on what's happening on the ethics side and sustainability. So as long as that gets programmed into how decisions are made early on with startups, and they are in their pitch deck talking about their sustainability along with their ethics and their values, then it'll be important on their agenda, and hopefully a young startup then will have that ingrained in their values. I think other things that VCs can do is that they need to appoint board members like Karen and like Nick, who represent an important part of the overall company fabric, which oftentimes is overlooked. You'll get people that are experts in, like a financial side or sales and marketing. But those are the kind of things that we can do for our young companies, so that when they grow up, it becomes part of their fabric. Let me turn it over to you, Mark.
Yeah, hey, Tim, those are great points. Adam, going back to what your question it was, and it builds upon what Tim said. For us, it was, we looked at things and we just said that from a cultural perspective as a company, we believe that was the right way to do things, whether it was how we're using cameras or voice or other ways. We decided to put privacy and protection of privacy and the control of privacy in the patient's hands first and foremost. And we did so. It was funny because when we went to raise money in Silicon Valley, they all told us, stop doing that. No one would give us $1. We raised over $120 million, not $1 out of Silicon Valley, because we said there's a right way to do it, and it's not your way. We're going to do it our way. And we've been successful doing so. We think at the end of the day, we wanted to align with what the privacy policies were of the healthcare system, because that's who we serve. And that's very different than what the traditional technology the ethoses are. So we did that. We think long-term it's a winning strategy, and it'll play out in the marketplace over time, and we'll see whether we were right or wrong. I think, Tim, what you're saying was really interesting. I think if we can find a way to both, it's one thing to have regulations and policies, but they're meaningless unless there's enforcement and there's accountability. I mean, if you can go back to the 90s, you have these clown shows of whether it's Bill Gates or Elizabeth Holmes or Mark Zuckerberg in front of Congress testifying. Nothing changes. It's just a show. It's ridiculous. I think you need to have real enforcement and accountability. And on the flip side, like Tim said, have incentives. We have a CHIPS Act, so we can onshore, semiconductor manufacturing. Is there some incentive so that if folks are doing the right thing from an ethical perspective, or the use of these different technologies, there's benefits for doing so? Do we, as Tim said, board representation in California, there's certain rules now in terms of the diversity of your board. Expand the definition of diversity. This is a critically important area. Let's include this as well.
Great, thank you, Mark. And it's interesting how we have emerging rankings of companies now in terms of their environmental impact and governance structures, and maybe that needs to expand to include how they go about the ethics of their company and how they go about safeguarding their data. So bravo to you, Mark, for sort of sticking to your values and principles and raising funds to run the company the way that was aligned with proper values. And I think it's going to be really what we're trying to do with DCI Network is really try to facilitate these conversations and to figure out how do we get from discussion to actual actionable, tangible change. And this could end up coming as a result of government policy change, or it could also come in through incentives that, so not a must-have, but an incentive to do that. Or it could also come through better education of people and certain companies growing by leadership. And so going to, following the lead of Erica's nonprofit, sort of trying to change culture and as those companies succeed, or it might be a combination of that. There's one question so we're going to transition now to the open session for questions from the audience. We do have one, and some questions have been answered through the chat, but we want to open it up. So please raise your hand if you'd like to ask a question verbally. We encourage that. And we do have one unanswered question here from Sahab Bedin, and I apologize if I mispronounced your name, Abhari. And do you want to ask your question verbally if you're online? You can just unmute and speak. Not sure if they not I don't yeah, I think you're still here. Would you like to ask your question? And so we'll see if they want to ask their question, and it deals with consumers and how to get them more involved in their so I'm not sure if they have a microphone or not. I can share the question. What is the role of consumers or patients in protecting their privacy in the digital age? So how do we get consumers more involved, and what's their role? For the panelists to comment, or anyone else in the audience.
Well, I would maybe chime in to start. I see, Adam, you were going to jump in too, but maybe I would chime in to start here and say this is actually one of the places where I think the technology community has actually a lot to offer. I mean, I think being obsessed with the end user and the user experience is fundamentally about understanding what the consumer understands about your technology, what they want, and how they can best use the product you're creating. And I think, unfortunately, in healthcare, healthcare is a sector that hasn't had a great track record of being user-friendly on a variety of fronts. So I think, consumers have a huge role to play. I just think we have to take that same mindset, not just to kind of think about the type of product that we're trying to create, but we actually have to kind of add a dimensionality to the product experience that includes what the topic of conversation today is about, and that is helping consumers understand what is this product or service doing with your data, and why is that good? What's the intended benefit? What are the potential risks or tensions that you as a consumer may need to think through, when you're making that decision to be onboarded onto that product, and to do it in a way to kind of go back to Adam's point, where you have a certain amount of willingness to trust that those consumers are going to make a decision that's best for them, and be willing to see what the market is going to react to if you are providing those opportunities and dimensionality for the consumers to really weigh in there. I think that the unfortunate reality is from the technology community side, we've often been consumer obsessed or end user obsessed with a certain set of dimensions of what we're doing when we're designing a product or service. But we've often been very hesitant to open the black box, if you will, to let them understand all of the things that the technology might be doing outside of what is being shown. And I think this is where, being a little bit more risky as a company to say, we're going to be transparent and build real trust with our consumers is actually, I think, a pretty winning strategy. But it's a longer time horizon, no doubt.
I was going to say something very similar. And one of the things you said was around making sure that the end user, whether they're a consumer or a patient, understands what's going on. And I think that it sounds fluffy, but I think it really comes to empathetic communication in the sense of you are putting yourselves in the shoe of this end receiver of information, and you're doing what you can to make sure that they know what's going on. They understand what they're signing up to. They understand what the risks are. And oftentimes I find that that's just buried away in legalese or in forms and paperwork. But what we're not really doing is giving anyone an informed choice. And I would that's what I would advocate for.
So I think the point of informed choice is really great words, because if you look at a lot of those legalese, you not only have to have a college education, you probably have to have multiple legal degrees to actually understand what they're usually 25 pages long with terms that most people can't quite understand. And how ethical is it to expect people at different socioeconomic levels to actually understand that? And so maybe what we need to do is just think about what are some best practices for what are proper ways for disclosure and transparency in a way that people can understand. And I've noticed that, for example, in HealthKit, there are some clearly written words, and Sage Bionetworks did some early work in trying to explain consent to low literacy and illiterate people. And so I think maybe that could be one of the best practices that we could try to figure out, is how do we clearly explain where the data is living, and whether it's locally on your machine, what's actually being transmitted, and how it's being used. And I think getting the patients to be part of the design from the get-go, I think would be perhaps useful to do. But then once it's built, how do we know that people are following up with that? So in terms of governance, like how do we trust that companies are actually following what they say, assuming that patients come to the table and help co-design this and they build this? What are your thoughts about how do we ensure governance? Can we trust companies to self-report that they're doing fine? Or should government be involved? Or should we ask nonprofits like organizations like IEEE to verify and test? They test electrical devices for and others. Who should be involved in governance? What are your thoughts on that, panelists?
Well, I'd just quickly, just as an example of a foundational technology like AI/ML, I think we're seeing a push towards third-party audit. We're seeing this in the EU AI Act. If you look at the New York law for automated employment decision technologies, AEDTs, companies that are using a subset of AI for screening or evaluation of employee candidates in New York are required to have an annual third-party audit to ensure that that AI is working in a way that is not discriminatory or biased. And so I think there is a recognition increasingly among societies and governments that it may not be sufficient to just assume that companies are going to self-report and that is enough. I think that, again, kind of echoing a comment I made earlier, I think as we see this convergence of foundational technologies like AI/ML being applied more concretely in a number of healthcare applications, I fully expect that we're going to see, whether it's through the existing, regulatory bodies like FDA or EMA, or it might require the advent of something new. But I do think we are likely going to see something very similar, where there is going to be a third body or a third party body or set of bodies that really provide some of that regulatory rigor in validating and on an initial and ongoing basis, kind of the role that some of these more foundational technologies are going to play. It's the tension between AI being the new electricity, but also being the new potentially asbestos, right? Where if it's everywhere and it's not done well, it can have a lot of unintended consequences.
I'd kind of additionally make a sort of different pitch too. I think you definitely need third-party agencies that come and do audits on these companies, but I would argue sort of personally on the better policies and protections for people who speak up also within these companies, and having clear guidance, because even if you look at something like fraud, even though we have a pretty strong infrastructure of audits for financial fraud, majority of the tips that come through that actually identify it are from internal sources. And so having some sort of infrastructure to really help these people, engineers, product people, whoever it might be, to have better policies to protect them, or other infrastructure that they have a means to communicate when something is wrong, I think is a key initiative, especially considering that there's so much domain expertise that you need to have in order to identify these issues, that I think even if you have an auditor come in, it's so complex, even understanding and being an outsider to examine what's really going on with these companies, that I think that's going to be really imperative with these new innovations and new technologies that are moving so quickly, is that we have, whether they're whistleblower protections, whether they're, boards that are pushing policies to safeguard the employment or reputation of people working within these organizations. I think this is one governance channel that's often overlooked, but actually really crucial to ensuring that there are good governance mechanisms over new technologies.
And how great to hear you, Erica, say that, because to a large extent it was you having a channel to communicate with the government that helped set in motion what stopped Theranos from continuing what they were doing. And so I fully so, and think of all the money, not only the harm they did to people by telling them the wrong information, but they also did harm to the financial investors. And so it's interesting how Mark said some of the Silicon Valley people don't seem to have learned their lesson, that they just want to go quick and fast and fail fast. But some of those failures are multi-billion-dollar failures, and more importantly, they hurt patients in real ways. And so I agree with you. Well, other panelists, do you have comments on governance issues and strategies the way forward? Who should be overseeing us?
Great that it needs to be a multi-layer approach. You can't, you embed it within the company, have across the team different mechanisms for accountability, incentives. I think you need to have consumers who have good digital hygiene, and also I think education that was brought up earlier. For 20 years, even NIH funded grants in universities still continue to support grants with consent forms that are written at the graduate school level. I mean, this is still not taught in our education programs. And then you see that out in the real world, that there's this general acceptance. But at the same time, we know that consent shouldn't be the only mechanism you rely on, the consent form, and that there should be multiple touch points. And so that has to be multiple touch points with the user, multiple touch points within the company, multiple layers of governance, hard law, soft law mechanisms. And that's really how you patch up the holes. And I think the other important piece is that there aren't clear good guys and bad guys. And it would be nice if there were such a thing, but companies aren't clear bad guys, universities aren't clear good guys. Really, as I taught when I was director of our ethics program at the university, the greatest way that people end up having unethical behavior is because they're limited on some sort of time or material resource. And the best way that we've promoted people actually using the compost bin, for instance, is by simply putting the trash can under the paper towel holder. So that's really what we need to do, is kind of make it easy, make it normalized, make it ubiquitous.
Great. So we're coming close to time. So I want to go through and ask each panelist if they could share in 1 minute their final thoughts, what resonated with them today, and what they think should be next steps in this particular field. And let's start. We'll go backwards this time. We'll start with Mark, Tim, then Adam, Karen, Nick, and then Erica. So Mark.
Yeah, sure. Well, thanks everybody, the fellow panelists and participants. This was really, really fascinating. In terms of summary, for me, Karen said it perfectly. To me, it's kind of like what Ronald Reagan said back in the day: trust but verify. We all want to assume the best, but again, let's have some systems, in place to be able to kind of get the behavior that we want. I think in terms of looking forward, I think we had a really good conversation here about a defined set of stakeholders that are involved. I think something that we might want to look into the future of 99.9% of the time, people are dealing with their health at home. 60% of health is impacted by social determinants of health that have actually nothing to do with our traditional healthcare system. So if we really want to look at how do we impact health holistically, we're going to open up the can of worms in terms of a whole other set of stakeholders, and whatever the policy, procedure, guidelines, governance that we want. It actually, if we really want to make an impact, we're going to have to open this up to a lot of other folks. Maybe get started with a defined set, but then look to bring that out further, because it touches so many different aspects of people's lives and different institutions and individuals that they interact with holistically. So the work doesn't end.
Thank you, Mark. Tim?
Yeah, I would just summarize that while there's a lot of sort of negative aspects of artificial intelligence, and generative AI, that in the healthcare, there are a lot of positives. So I always try to plan for success, and let's plan for success with AI in healthcare and how it can be better, and make certain we put some governance in, at the beginning with small companies, and at the top with larger companies, and really put it on them to make AI a positive impact on healthcare. And obviously there are negative sides of that we need to take into account, but let's focus on the positive.
Great. Thank you, Tim. Adam? Oh, you muted.
Yeah, sorry about that. Not opposite of Tim, but in a somewhat more cynical vein, is I think about the forcing functions that lead to change. That large language models, AI, ML have existed for many, many years. And it's just now that we're really trying to encourage change. And that's because people are scared. It's been so widespread that people are scared of what's going to happen, where that fear is the same valid fear 10 years ago as it is today. But it's at such a level that people need to make change. So I'm cautious and concerned, but hopefully optimistic about what this looks like for the future of data, where legislation often comes from oops, there was a problem and then let's change it. How do we get ahead of these problems before we have to now create solutions for real damage?
Thank you, Adam. Aaron?
I really appreciated this opportunity, and I think I learned a lot. I want to also emphasize that I appreciate Adam's point of view, maybe we're a young thing, that there's things to watch for, but there's lots of promise. And I think a proactive ethics by design is really one of the best approaches. I think 2 points maybe for our end users and patients, lived experience advocates, is to consume media critically and to be wary of hype, which is something we didn't talk about, including ethics hype, which exists, by the way. And also to consider kind of a future where non-health data is actually becoming health data. This is why you see companies like Amazon starting its own health branch. Apple never started as a health company, has health offerings. We're in an area where we have lots of opportunity, but we also have to be cautious about the interconnectedness of those. And it's really important to be a critical consumer and also take opportunities to help create the future that you want to see.
Great. Thank you, Karen. Nick?
Yeah, great discussion. I think back to the title of this webinar about, are my devices listening to me? And I would just say that, listening is often a term that we use when there's a recognition and acceptance by both parties that there's conversation being had, as opposed to, say, eavesdropping, where it's not made aware to both parties. And I think, moving forward, I think that's kind of a foundational way that I think we want to make use of health data. We want it to be relational. We want it to be transparent and understood, that we can make the best use of it for all the parties involved. I think the opportunities for health data are incredible, but we have to do it in a way that is relational, that builds and promotes trust.
Thank you, Nick. And Erica, last word.
So thank you everyone for this wonderful discussion. I think for me, what it really grappled is this is a very complex, multi-layered problem, and each of us has a role in terms of providing better ethical standards within healthcare technologies. And it's sort of figuring out what responsibility can I have over my maybe sometimes small domain to really start implementing this and moving the needle on changing the direction of which this could go. So whether you're a nonprofit, helping in my case, small startups and private companies in regulated spaces, whether you're a big, large corporate that's been in the industry a long time, if you're a regulator, or someone who is a more established company, that we each can sort of take our share to sort of carry this forward and actually see some actionable change.
Thank you, Erica. And thank you to all the panelists. We will be organizing more seminars on how we aggregate massive amounts of data and ethically use them for both real world evidence collection, meaningful patient engagement. And we have a third theme that we will shortly announce on DCI Network, trust in the AI. And that sort of builds on this. How do we trust that these AI systems not only are giving us valid suggestions, but that they collected the data that they used ethically. So that'll come over the summer, and we're planning a big event in September. So tell your friends about DCI Network. Please comment on the LinkedIn and social media, what you learned and what you opinionated from today's talk, and invite people to sign up and catch the replay. Thank you very much, and we'll be in touch soon. Take care. Have a great day. Bye-bye.